So, good morning, everybody. Welcome to our workshop on learning from journals in literature reviews of COVID-19 research. This workshop includes two teams from the project PHIRI, work package 5, that is interested in research methodologies and data pathways and research methods pathways during COVID-19. And our capacity building team that is transversal to all the PHIRI projects. Especially in work package 5, we've been working hard on doing literature systematic reviews, and it's from that experience that our wonderful team is today showing and presenting and sharing experiences. So hope you enjoy this workshop that is going to be fruitful. To start, I have the pleasure to introduce my colleague, Daniel Caldeira, Professor Daniel Caldeira, which is a young doctor, cardiologist from the main hospital in Portugal, and also professor at the Faculty of Medicine. Daniel is also a specialist in clinical pharmacology, and I have had the pleasure to find him sometimes in the corridors and discussing on literature review methodologies. So that's why it's important to us, and we invited him to be here. So he's not really directly in the project, but it's with pleasure that we brought him to talk about what he knows about literature systematic reviews. And thank you, Danielle. Welcome. The floor is yours.
Thank you very much. First of all, I would like to take your kind invitation and your kind presentation. In fact, systematic reviews are a topic that I enjoy, and I hope that I can talk about some things that are not can be out of the box somehow, and are not stated in the mainstreams of books or about main documents of reviews or systematic reviews. So it's up to me to talk about stepping stones of literature reviews of population studies, and I will start about talking about systematic reviews. What are systematic reviews? And here we have some definitions. The first one from Chalmers and Haltman. A review is a literature review that was prepared to make a systematic approach to minimize bias and random errors, which is documented in materials and methods section, which means that somehow these authors state a parallelism with, for example, other scientific methods. If you go to work on a bench, on a lab, you must have a protocol, and that protocol must be executed on your materials. Either they are tissue materials, either they are mice, for example, but the investigators must fulfill the requirements or the guides of the protocol. And systematic reviews, in systematic reviews, we imported the method to the literature review field. So we must pick a question, we must have a guide, and we must execute that guide in order to have something consistent. Another review with more detailed, which is more detailed. It's from the Cochrane Handbook, which is a systematic review. It's a type of review with a clearly formulated question that uses systematic and explicit methods to identify, select, and critically appraise relevant research. And I will focus here on critically appraise, because in my opinion, this is one of the main differences between a systematic review and other types of review, because they need to have a tool that helps the researchers to critically appraise the studies and the generated evidence. And afterwards, the evidence is collected, analyzed, and they can be included in a statistical method, which is meta-analysis. But this is not a mandatory step. This is an optional step that must be discussed within the team. If this is if this is a step that is worth taking on, or sometimes we have many different studies which we cannot mix on the same question, and meta-analysis are not appropriated in that setting. So, as I was saying, there are some different types of reviews. These are the main two types of reviews: narrative reviews and systematic reviews. May I say that narrative reviews, the value of narrative reviews rely on the authors, because if we do not have an expert on a certain topic, perhaps the credibility of a narrative review may be stepped down. So narrative reviews are reviews which the question can be large, broad question. The sources and search usually are not specified, and study selection also not specified. The critical appraisal, it's variable and it is not mandatory. The synthesis is qualitative, and the inferences are opinion-based and sometimes evidence-based, which means that the conclusions are most of the times based on the opinion of experts. That's why I told you that the value of narrative reviews are mostly depend on the credibility of the investigator, because one can propose a topic for a narrative review, but sometimes journals themselves ask for credible investigators or for experts on a certain topic to write a narrative review within a field. On the other hand, systematic reviews, which bring on the scientific part for reviews, usually have a question which is focused. The sources and search are specified and are broad to be sensitive, which means that we do not want to miss any study that brings information to our question. The study selection follows a specified criteria. The critical appraisal is rigorous, using known tools. The synthesis is mostly quantitative, and the inferences are usually evidence-based. In opposition to narrative reviews, which I told you that some of the credibility can be arise from the authors, here the credibility is on methods, and that's one of the major gains of systematic review. Another gain is the reproducibility, which means that any author that follows a detailed protocol of systematic review usually retrieves the same results, which is good for science, because if we have a protocol which is not able to be reproduced by other people, this means that we have some problems. When we talk about systematic reviews of good quality, we are talking about a type of publication which is on top of the pyramid of evidence. But as I told you, these systematic reviews need to be of good quality. And to be of good quality, we must search the studies that adequately answer the questions that we pose. For example, for intervention studies, whenever is available, it's desirable to include randomized control trials, because we know that that's the type of studies that most robustly establishes the causality between an intervention and the outcomes. And afterwards, of course, if we do not have that type of evidence, if we go to other types of studies, we must know that we are downgrading the quality of evidence, even if we are talking about systematic reviews. So these are the basic steps of a systematic review. This is an example of the line of steps in the Cochrane systematic reviews, which we start on defining the question, and afterwards registering the title, planning the eligibility criteria, methods, publishing the protocol, searching for studies, applying eligibility criteria, collecting the data, evaluating the risk of bias, analyzing the data, presenting the data, and interpreting the results. And afterwards, publishing the review. In Cochrane, we usually have this commitment to update from time to time the reviews, because new studies are always coming, and the team which is responsible for a certain topic has this commitment to check on new data, to inform all the stakeholders about the conclusions of that question. This is just an example. This is a picture on how a systematic review can be complex, and that a systematic review must be performed by a multidisciplinary team. For example, to define the question and plan the eligibility criteria, these steps must be performed by experts on the topic and also methodologists. Why experts on the topic? Because the experts know the gaps on the evidence. They know the need for further evidence on that field, and also can help methodologists to plan for some steps regarding, for example, the type of population that should be included in the questions, the type of intervention or exposures. How broad we can define these two fields, for example, populations, interventions, comparisons, outcomes, and which type of studies the stakeholders in this area are interested to have the results on. And afterwards, we have here librarians or search specialists to search for studies. So this is not an isolated steps. There must be an interaction between experts, methodologists, investigators, and librarians. Why? Because some keywords can be out of the scope of the librarian, and methodologists or experts in the area can say, okay, but in my experience, there are some articles where they do not use that term for that disease. We use an alternative term, and sometimes those terms are not interchangeable. So there must be an input from investigators, the experts on the topic, with the librarian or search specialists to have a broad and sensitive search. Then the field investigations, after a search, apply for eligibility criteria and collect the data, and then the next steps are performed by investigators, methodologists, and statisticians. So a systematic review can be as complex as this scheme. This is just an example. Of course, one investigator can have multiple skills, and this scheme can be more simple. But This means that for a systematic review, we need a team with multiple skills. So the first step on a systematic review, and for me is the most difficult one, is to establish a question. And a good question must find the PCOTS acronym and must also fulfill the finer criteria. PCOTS refers to the population, intervention, comparison, outcomes, timeline, which is not always mandatory, and study design. Of course, the PCOTS, it's designed for interventions. So if we talk about other type of questions other than interventions, for example, prevalence of a disease, incidence of adverse event, the risk factors for a certain disease, which means, for example, etiology. We have different types of PCOTs. Sometimes it is not a PCOT, it's PICO. Other times it's PECO, where the I it's replaced by a E, because we do not have an intervention, we have an exposure. And here are some variations of the PICO question, and I believe that this is quite relevant. And as I told you, the question must be finer, and being finer means that the question or the answer or the methods for applying to retrieve an answer must be feasible. For example, as I told you, systematic reviews are usually based on focused questions. But this is not always true. For example, in British Medical Journal, there are some systematic reviews published with more than 100 randomized controlled trials included. This is the example of antihypertensive drugs to prevent cardiovascular disease. This is a very broad question because we have many antihypertensive drugs. We also have many types of cardiovascular disease, for example, stroke, myocardial infarction, and even the procedures to treat those diseases can be considered outcomes. So this is an example of a broad question. The problem it's that most of the times we need a very large team, with most of the team dedicated 100% to the project, to have a timely answer to that question with that broadness within the question. Most of the times we do not have those resources, and if we go to such project, we must have an insight that when we finish our project, probably there are so many new studies that probably the results are not updated and are not credible according to the best available evidence at the time. So we must know what are our resources, and if the broadness or strictness of our question is somehow feasible according to our resources. The question must be interesting, novel, or at least an update of something that is outdated, ethical, and for being ethical, sometimes it means that we should not duplicate our efforts if we believe that that question is already answered in the literature. It's somehow debatable if we should duplicate that effort. It is debatable that there are some investigators that are favorable to have their some works duplicated in order to ensure the consistency. But that's one topic, because resources, using resources to to answer a question that is already answered, it's debatable and also relevant. So after we planning the eligibility criteria and planning the methods, there is a search, and a search goes through some bibliographic databases. These are some of these are, I would say, the main. The top three are the main databases, which is Central. Central is a database of Cochrane for controlled trials, which means they are more directed for intervention studies. Medline and BASE, and this is Web of Science core collection. Of course, according to the type or the scope of the question, other databases can be searched for. For example, if we look for psychological outcomes or psychological conditions, we can search for PsycInfo, which is a database more directed to that field. We can also search in other journals and other databases, as I told you, and also for registries of studies, which we are going to screen for unpublished, and as well as for ongoing studies, to give us also an horizon pipeline of the investigation on our question. Then we apply the criteria that we established by 2 or more investigators independently, and then we apply the risk of bias tools. There are different risk of bias tools according to the questions that we pose. These 3 are the most known ones. The risk of bias tool from Cochrane, which is currently in the 2nd version. This is a tool applied for randomized controlled trials, and here are 2 tools used for observational studies, which is the Newcastle-Ottawa scale, and this is the Robbins I, which is also a tool that is recommended by Cochrane, but has some pitfalls. A good example on how systematic reviews can be used to retrieve the data to answer to relevant questions. I brought 2 examples. One of them is this one, when in 2020, in the beginning of the pandemic, Fang and colleagues published a letter on Lancet Respiratory Disease, where they called for an hypothesis that patients with hypertension and diabetes mellitus could be at increased risk for COVID-19 infection. The rationale about this hypothesis was based on basic science motives regarding the expression of some molecules, ACE2, which is increased in patients with diabetes mellitus and hypertension, but also regarding some drugs that are used in these patients to control the blood pressure and also to prevent the decline of the renal function in these patients, which are the ACE inhibitors, which are some very well-known drugs for the people who use or who treat these drugs. At this time, there was some noise and some doubts were raised in the mass media and also by the patients, and some scientific societies came out to say that this evidence was not robust, and the patients that were treated with these drugs should not withdraw the drugs, and that was the question. The patients asked us if they should withdraw the drugs because they could increase the risk of COVID-19 infection, and scientific societies say it is early to establish some definite conclusions. And what we did afterwards, of course, it was not timely because at that time we did not have population-based studies, but some months afterwards we had, and then we published a systematic review, this time with meta-analysis, where we evaluate not only the AC inhibitors, which are the angiotensin converting enzyme inhibitors, but also another related drug, which are the ARB, angiotensin receptor blockers. And we performed a systematic review in which we included many studies. And the conclusion was that any of these drugs, or as a class, increased the risk for having COVID-19 disease, having a COVID-19 death, or having a critical or severe form of COVID-19 disease. So this was important. A last example.
Tem 2 minutos.
Okay, thank you very much. The last example is about this warning about the FDA. I believe that Emma has also warned a similar with a similar issue, where at the beginning also of the pandemics, that ibuprofen should not be used in patients with COVID-19. What we did afterwards, we also performed a systematic reviews, and we evaluated whether NSAIDs, which means that non-steroidal anti-inflammatory drugs, could be associated with increased risk for SARS-CoV-2 infection or worse outcomes with COVID-19 disease. And our conclusions were similar to the previous reviews, which are that these drugs do not increase the risk from having the disease and do not increase the risk from having the worst forms or the worst manifestations of this disease. So to conclude, systematic reviews aim to answer questions based on available evidence. And they use standardized methods, and it is important to have a multidisciplinary team. And in the COVID-19 question, the context, they helped us to keep informed about data that was emerging, and sometimes we reassured regarding decisions. Thank you very much.
Thank you, Daniel. We have 1 or 2 minutes for some questions. You feel free to open your video cameras and your microphones and make the question live, or you can do it through, if you're shy, you can do it through the chat. Okay.
They are
So
shy.
you have Daniel's
really
contact, so if there's any question that comes further, you can contact him. I would like to thank Daniel that gave us the foundations and explained the differences. I was actually very, one of the things that for me was important from your talk was the importance of having multidisciplinary teams, right? And I was thinking that sometimes PhD students do systematic reviews and as the first paper for their thesis, and they do it by themselves. So that's asking a lot.
Yeah.
It's not realistic.
But as I told you, one person can have many skills. Nevertheless, I believe that they would benefit from having inputs from experts from other fields. Yes.
Yes. So actually here on PHIRI, that we had such a large task about reviewing literature on specific topics about COVID, but very broad topics. And our strategy was to use and to take advantage of being a team and involve lots of people and make this huge task possible. And that's the reason for this workshop, is to show you and a little bit the process that we had in PHIRI here and what we've learned from it. So I'm going to move to the next speaker. Thank you very much, Daniel.
Thank you very much.
And the next speaker is Cesar Garriga. He is a doctor in epidemiology and public health. He works at the National Health Institute, at the National Center of Epidemiology as a researcher. And he's been directly involved in in a literature review in PHIRI. And he has developed his scientific activity as epidemiologist and data scientist using big data from patient databases at the University of Oxford. So Cesar will talk to us about the scoping reviews, about the challenges of leading a very large collaborative group, and he's telling us a little bit about his experience and his approaches to those challenges. So Cesar, all yours. Thank you.
Thank you, Joao. I'm going to tell you about more the process and the difficulties that we found in the process. And for this project, we conducted a scoping review. Scoping review is a bit different than other systematic reviews because we are not focusing the results of the studies. We are focusing the concepts, theories, sources, or knowledge gaps. In our case, for our scoping review, we focused on the key health indicators that they they have a direct impact caused by the COVID-19. We looked for that information in the scientific literature. And we were interested specifically in those indicators about morbidity, severity, and mortality. We were interested in how they were calculated and the limitations that the researchers experienced implementing them. Then the results that we are expecting for this scoping review is to see what of them they were more commonly used across the scientific research and to compare maybe with the public health services. For this reason, we followed the PRISMA guidelines for scoping reviews, and we divided our research in three steps, three phases. The first one, it was related for screening titles and abstracts. And from this step, we retrieved or selected some titles. And for the second phase, we have to read in full and to extract the information related to the papers. And after that, we even have another stage that it was to retrieve the information for the indicators, because from one paper we can have several indicators that we can be interested on them. To do so, then from our institution, my colleague Teresa Valero and I, that we are in the picture on the left, we conduct all the process, and also we count with we really appreciate counting on 14 collaborators from 10 partner institutions across Europe, the different public health services across Europe. And you can see nice pictures of them. And we split in two teams. Teresa and I, we were the team one, and we were coordinating, and the other people, they were the team two. Then across the different phases, we have different challenges. And now this talk is focused to show what challenges we found and what was the way that we overcame those challenges. For example, for the first phase, the screening, in the phase that we have to screen titles and abstracts, the challenges were that we have to manage a team of collaborators, and we never haven't met before with them. Also, we expected from them that they had different levels of expertise. And also, when we contact to them, some of them, they put the limit that they only had maybe 40 hours to contribute to the task. They were not plenty 100% available for us. The point is that they would work for free in these tasks, and we need to assign to them feasible tasks in order to conduct this scoping review in a collaborative way. And for example, for the first point that I listed before, to manage a team of collaborators that we've never met before, we organized an online session with them. We prepare a detailed agenda in order to assign the tasks, and we circulate with them a protocol. In that protocol that we elaborated before, we presented to them the different phases of the review and the exclusion and inclusion criteria. And the idea is that we showed to them that we were ready to start to work and provide them tasks. One of the challenges for this first phase, it was this limit of the time that they have available. Then we told them, okay, that's okay, but Rayyan, the tool that we are going to show later, has a time control. You can check in Rayyan how is the time that you are investing doing the review. Another point, it was that maybe we were going to find different levels of expertise. For this reason, first of all, between Teresa and I, we conducted a pilot test to know what were the difficulties doing the screening of the titles and the abstracts. And this pilot test, it was that we reviewed the 5% of 3,700 titles and abstracts. And we compare between us the level of agreement that we had. And after that, we trained our collaborators in the Team 2 for using Rayyan. And we explained to them something similar that maybe we are going to explain later about how to discriminate between eligible and not eligible titles and abstracts, how to rate them in terms of you decide to include or exclude, and also to create labels. And other challenge, it was how to deliver the tasks to the collaborators. Then, for this point, the collaborators in the Team 2, they assigned to them the role of reviewer 2. While Teresa and I, in our institution, we played the role in the role of reviewer 1. The point it was that they have less papers for reviewing. And why? The point is that they were not paid for these tasks. Then they used probably their spare time. However, the institution had the commitment to participate in the tasks. Then the point that, or the approach that we follow was to create folders for each collaborator with a specific number of records for reviewing. And Teresa and I, we have the half of the papers for Teresa and the half of the papers for me. And we have also assigned the different collaborators. And we followed with them bilateral meetings. For the second phase, the full text reading phase, the challenges, it was the data extraction. Also, it was how to read a very big number of papers in full, and also dealing with tough deadlines. Then, for the first point, data charting, our approach, it was to populate a template. We prepared a template for them. It's very basic, as you can see below. We prepare in Word, and we conducted a pilot test with them. We assigned 10 papers for each member of the team 2. And in total, they reviewed, as a reviewer 2, 110 papers. And we, Teresa and I, reviewed the very same papers. And we had bilateral meetings between the team 1 and the team 2, reviewer 1, reviewer 2, focusing on extracting the information in a harmonized way.
César, tienes 2 minutos.
Okay. Sorry. And another challenges that we found is that other challenge it was to review lots of papers in full. As I said, we were running short of time. Then we sought our colleagues in Team 2 where they could find the information. For this reason, we prioritized searching into material and methods section and tables and graphs from the results section to identify and describe the indicators. We advised them to go through the discussion section looking for possible limitations or strengths associated with the selected indicators. For the last phase, we created an online survey in Google Form. See the picture on the right. Team 1 tested the survey before sharing with their collaborators in Team 2. Due to the limited availability of the collaborators, we delivered to them a 50% of the eligible studies for indicator data extraction. Then, Team 2 completed a survey for each indicator. In addition, Team 1 checked that all the fields required for each indicator were correctly completed and in the indicator charting form. Team 1 also checked that indicators identified in the full text reading phase were those reported in the phase 3. About the lessons learned, basically is that each phase of a scoping review, at least in our experience, have different challenges. We need to involve people during all the process. Then we needed to have some flexibility to adapt the tasks to the time available. And this is all. Thanks for your attention.
Thank you very much, César, so we will leave the questions for the end of this roundtable. So we will move now to Tatiana Makowski. She will talk about systematic reviews, strengths and challenges of in-pair reviews process and quality of assessment of included studies. Tatiana is a medical doctor with a master's and PhD degree in public health and epidemiology. She has interest and very an extensive research in the field of multimorbidity research, and she right now is a researcher and coordinator for the French National Public Health Agency. So thank you very much, Tatiana. You go ahead. I'll remind you when there's about 1 or 2 minutes to finish, so we can keep on track. Thanks.
Okay, yes, thank you, Joao, for a nice introduction, and thank you everyone for being here and for this opportunity to share some experience with you. We'll just share my slides. So thank you, and thank you for the presenters before me for such nice actually setup of the subject. So some of the things maybe I'll just slightly go through. And I hope there will be no much repetition. Maybe it's not bad to be some of the repetition, to have some repetition in case somebody forgot something. But so Daniel has actually very nicely explained the steps of the systematic literature review, which are here. And I do really, if I need there's something to repeat, is that, for example, if you have a chance to consult librarian and documentalists, please do so, because they're very helpful to trim your research. To add some keywords that you haven't thought of, or to actually exclude some that are redundant. And do think about the key terms once you formulate your research strategy, and the key terms in the research question. Key terms are usually in the research question, and then look for all possible variations of the key terms, and do read the literature on the subject. Maybe this is something practical that I could say. If you're struggling to identify key terms, read the literature on the subject, consult dictionaries, look into the English and American expressions, and also consult librarian. Daniel has mentioned some databases, PubMed or Medline, that he said, or Embase, are the must, by my opinion, for the population-based studies in medical field, but two are not sufficient, so you should consider others. To develop protocol, I have put here Prisma P, which is actually the checklist, a checklist for items that you should include in the protocol. And I think it's a very valuable tool when you're constructing your protocol to think about all the steps. And do register your systematic literature review in Prospero. That's how you also protect your research question, and it is visible. So if somebody, as Daniel spoke about the novelty, so if somebody wants to see if something has been published or on the way, Prospero is very useful, so they can see that you're actually conducting research and that you have registered it. But I will focus on these three steps, and Cesar has already nicely introduced some of his experience, nicely explained some of his experience, which I think it's overlapped with experience that we have had in our PHIRI literature review, and I think that this systematic literature review was rather specific in a sense that we have explored three different exposures. That means multimorbidity, frailty, and socioeconomic characteristics to within patients either not yet tested COVID positive or COVID positive, to see their likelihood of being infected, or the outcomes they might develop once they are infected. So the keywords, for example, that we have used are all the variations of the key terms: multimorbidity, frailty, socioeconomic characteristics, COVID-19, and also study design. We didn't use the keywords for the outcomes because we wanted to explore which outcomes have actually been evaluated in the literature. So this is just a part of our research strategy, which I wanted to show you how exhaustive it has to be. As Daniel's also said, it has to be exhaustive and it has to be specific. I think it's also very difficult to have both. And you're most likely to end up with some noise. That is something that we call when you actually have the articles that you don't expect to find in your research that are rather unrelated topic. So here, for example, we were lucky to consult our documentalist, and we have used the article. We have used one of the research strategies already published, where there were some people looking into the best research strategies to investigate COVID-19, and we adjusted it, considering that the subject was developing. There are some other additional key terms that were evolving and being used. So I hope you can see this. I know it's rather small, but this is the Prisma diagram, and this is how you will report your systematic literature review, all the steps. So for example, here in the beginning, you have all the databases that you have used to retrieve the articles using your key words or the strategy, how many you have found per each database, how many you have excluded deduplicating the articles, because you're more likely to find duplicates when you use different databases. Duplicates, which means that the same articles in databases. Then records screened. This is the title abstract screening phase, and this is the full text screening phase, where you report the reasons for exclusion and how many articles you excluded for which reason. So just maybe something to mention here, which actually was a bit rather confusing for me when I was doing my systematic literature review. So you can see that, for example, Prisma does not ask you here to report reasons for exclusion. This is a title abstract screening phase, while it does ask you to report reasons for exclusion and how many articles were excluded in the full text screening phase. So I can say that I have done systematic review where we haven't reported here the reasons for exclusion, and it was accepted in a very good journal. And but in this systematic review that we have done with PHIRI, we actually decided also to specify in the report reasons for exclusion at title abstract screening phase. Why we have decided to do that is also, like Cesar said, we were fortunate to have a large team of researchers to work with us on this topic, but it also, one has to be careful to make sure that everyone understands properly the screening process and exclusion criteria. So in our PHIRI systematic literature review, we have retrieved about 10,000 articles after the duplication. So we decided to have two first reviewers where each had 5,000 articles to screen, and then we had 10 second reviewers where each had 1,000 articles to screen. And we have assigned a third reviewer because, as you know, you should have one third reviewer in a case that the first and the second reviewer cannot agree whether to include or exclude the article or the study. So we have conducted this in Rayyan as well. And we have used this exclusion criteria. We have formed this exclusion criteria in a very broad way, so that it's easier to exclude articles at this phase. But another thing that we have applied here is that we have used the hierarchical ordering while assigning the exclusion criteria. What that means is that, for example, usually the article or the study can be assigned more than one exclusion criteria. So in case that the article can be excluded by based on the exclusion criteria 1 and 2, we decided to exclude it on the reason 1. And that helped us eventually in Rayyan to count how many articles were excluded for which reason. And we have also conducted pilot tests that was very useful, and to see actually what is the understanding on the exclusion criteria between the first and the second reviewer, and also between the two first reviewers, to make sure that there is the least possible heterogeneity in understanding and eventually in the screening. And we have had weekly meetings, group and individual, to make this clear, and that we understand that we are actually on the same page during the process. So for the full text screening, we have specified we had more detailed exclusion criteria. And so here we have conducted this phase, again, the same procedure in EndNote and Excel. We felt more comfortable in that way. And we have reported the disagreements. You have to report the disagreements also the title and abstract screening phase, and full text screening phase, the disagreements between the first and the second reviewer. And that is something that has to be reported also in your publication. And that is why it is so important to actually make sure that first and the second reviewer understand each other well, so that the heterogeneity in the screening and disagreement percentage is actually low. Otherwise, you might enter into some explanation that you don't want to, because it is not good actually to have a large disagreement percentage between the reviewers. For the data extraction, Shara, could you just tell me how much time I have? Because I forgot.
You have 3 minutes.
Okay, good. I left my phone there and I don't see. Thank you. So for the data extraction is also done with two people, so for the first and the second reviewer, and we have used so we have used Excel for that purpose, but before you prepare the Excel table and you think about all the information you want to extract and you want to show in your, for example, report or the article, and that can be related to the study, for example, the study year, or like Cesar actually presented, the study population characteristics, the age, sex, socioeconomic characteristics, etc., but also information on the exposure and the outcome, as well as the measurement of the association. So data extraction is done in pairs independently, but then you also compare, which means that whether the first or the second reviewer literally read what he or she has extracted, and the other person actually compare, and then you agree on what you have, and that is what you will eventually present. In parallel, so while you're extracting your data, you should assess the studies for quality, and you're extracting the data only for those studies that you have retrieved and that you want to report on, of course. So to assess the quality, you should do it in the same time while you're actually extracting the data, because you already know the article very well. If you go back, if you, for example, extract all the data and then you go back to extract, to assess the quality for the studies again, you're more likely to forget the articles, and that will be like reading over again. So I suggest that's doing at the same time, assessing for the quality and also extracting the data. But as the quality, you have different databases. Daniel has mentioned that we have, I, for example, use these both, and Newcastle-Ottawa scale is very popular scale, and it is very much used. The only thing is that they, for example, have for cohort and case control studies, the original scale, but there is an adjusted scale for cross-sectional studies. So if you need more information, I can give that later, but you can use that scale is very well used, but there are also some others. I just wanted to actually show how it looks like, if I can just to give some insight how this is actually done. So this is, for example, do you see now?
We still have the same screen. Okay, now we see it.
Okay. So I just wanted to show that this is actually the assessment scale for the cohort study. So you have certain questions on the selection, on comparability, outcome. And you have to discuss this before you start evaluating studies for quality, because there are certain things that you have to agree on. For example, the comparability of cohorts on the basis of design analysis, study controls. So what would you like your studies to be controlled for, so that you can give them 1 star? And also what additional factors you want the study to have in order to give them a 2nd star, and so on. So to go back, so in the end, it will look like this once you make a summary table for the quality. So this is the selection criteria and all the questions that you have had that I've showed you just now, and how you scored, either giving 1 star or 2 stars. And at the end, you will have a total, which will be actually your score for the quality of the study. So some just concluding remarks. There is a great advantage in working in pairs, even though there is some discussion now how much we actually miss once we have 1 reviewer only. But I think it's very reassuring if there are 2 people doing the review, not only for the screening to miss the studies, but also to extract what is relevant to extract, and also to report on the study quality. However, if there are many reviewers, because as you know, usually systematic review is done with 2 reviewers, but if you have more second reviewers, for example, you have to make sure that you understand criteria well, so that you don't end up with a high percentage of disagreement. So try to make regular meetings to clarify. Time constraint, as Cesar has nicely explained, that was also the case for us, time constraint for each participant, and one should think about that. And what we have found is that also the time for conducting of a systematic review was not necessarily much shorter when we had many people involved. It was somewhat shorter, but systematic literature review does take a lot of time, and it did take time because there was also way to, I mean, many articles to scroll through, but also due to the time constraint for each participant, but also because there was, we had to make sure that there's no heterogeneity while we screened. So thank you very much for the presentation.
Thank you, Tatiana.
For listening, for listening. Yeah.
So we'll continue in our journey of literature reviews with the talk by Marilia Silva Paulo about the challenges of defining PICO or PIECO criteria to assess non-clinical COVID-19 outcomes. And Marilia is a doctor in health policies and development. She has worked on health service research, health workforce development, and environmental or occupational health. And she has been working on systematic reviews and meta-analysis of environmental and occupational health exposures. And now she's also participating on the PHIRI. So Marilia, welcome, and go ahead, please. I will let you know 2 minutes before the time.
Dear João, thank you very much. I would like to start to acknowledge the invitation to be part of this workshop. And also, I hope to contribute to the talks that have been delivered by my colleagues, and they were very, very interesting. My little presentation will focus on something very specific, which is the PICO, the PECO, the PICOs, the PICOs. It has some variations in according to the objective of our review, but this specificity is that it is transversal from the beginning of our review until we finish our review, and it is something that we have clearly considered at all the times and decisions of the review. Okay, so as my colleague Danielle has showed, the systematic reviews are considered the gold standard, and their methods have evolved a lot during the past few years. And as now Tatiana just showed as well, the inclusion of quality of evidence, risk of bias are determinants to perform a nice review, and it kind of summarizes all the other types of study designs that are considered specifically in the clinical setting. So what is the importance of what is PICO? It was already mentioned here. As you also know, the Cochrane group is considered to be one of the references in systematic reviews, and they emphasize that the importance of a well-formulated research question to guide an intervention review, or other types now as we've seen it's progressing, and to provide the clarity about the individual PICO components. So the PICO is described using a controlled vocabulary terms that will guide us when we perform our search string. The PICO search allows you to use those same terms to find reviews most relevant to your PICO questions, and something that we usually have in mind is the sensitivity and the specificity of the search when we do it. So as Tatiana also said, it is very important nowadays to include medical librarians, as this is their core and their scientific expertise. And a recent study has shown that 313 research studies reported that over just half of it do not report the 4 PICO components. So this is not, I don't want to say this is not the best practice, but in fact, this is not the best practice, as we have to have always the PICO components well-defined and well-reported in our scientific publications, because they are the core and they are what guide us to our results. So very briefly, this was already mentioned, but what is the P? The P is for population. Basically, it is for the patients or for the problems. So a few examples I'll give here is, for example, what are the characteristics of the patient or the population? So who do we want to visit? Some results regarding children, age groups. We should define the age group. Adults, which kind of adults, if it is someone like diabetic people. So who is our population or patient group that we are looking at? This is very important because later on we want to, or we may not, but we want to compare populations. So this definition in the eligibility criteria is determinants. So we can have inference. So thinking about the intervention and the exposure is being recently added to this field of systematic reviews and meta-analysis, specifically also for environmental studies that are leading to clinical outcomes. So one of the example can be what is the exposure and what are the limits. The limits is very important to have it clearly defined, that the population is exposed, and for example, cytotoxic drugs in healthcare workers during COVID can be an example, or an intervention, which can be a question like, what is the intervention under consideration for this patient or for this population? What is the drug? What is the surgical interventions that they were exposed to? So what is the comparator? Do we want to have a comparator? If we want to compare groups of populations or the same population that had an intervention with the ones who did not have. So what is the alternative for the intervention? It's a different drug or a placebo, or we have no comparator, it's also possible. Or who was exposed and who was not exposed, and do we want to compare them? This is the comparator. The outcome. The outcome is perhaps the key, and so many times when you're designing a systematic review, especially if it's for the first time, we tend to focus on the outcome. So what are the relevant outcomes that we want? It's usually that we find a systematic review with 2 or 3 outcomes or even more. So, for example, what is the quality of life? What are the adverse events of a drug in a specific population? This can be the outcome. The outcome can be also at the development of a disease due to an intervention or due to an exposure. And thinking about the PHIRI and specifically what we're doing at task 8.5, it can be the impact of an intervention. Although thinking that the outcome has to be measured to be comparable within a population and an exposure and an intervention. So we need to think how we are going to measure the outcome. And this is also very, very important. What about the study designs? What happened with the study designs is that we cannot combine study designs because we will be mixing pears and apples to try to have a qualitative summary or eventually a meta-analysis, and this would be not correct. So usually when you mix more than one study design in the systematic reviews, then you will have a meta-analysis specific per study design category. In summary, the PICO defines the objectives of the review or guideline and answers the research question. And it has happened, I think, to many of us when we are screening, as Tatiana was showing all the progress, we are screening and we find a very interesting paper, we get lost, we read the paper, it is super interesting, but then when you go back and you think, but what is my PICO? This interesting paper does not fulfill the criteria to be included in our systematic reviews. So the PICO is linear and transversal to the entire process of the systematic review. What has happened during the pandemic that we lived in COVID-19 was just too much information being released in a short amount of time, and it included obviously editorials, commentaries, scheme reports, that, as we just saw, were the bottom of the evidence pyramid in my first slide. But they are very valid when we know nothing about a disease or a virus, and the information has to be spread out in the scientific and medical community. So when we perform the PICO again, because we want to do a systematic review or a meta-analysis, we should think how and how we will get the most important information to answer our research question. When there is too much information, the PICO is even more important, I would say. Just an example of a quick search that we've done in 2021, that we just combined public health with COVID-19, then modeling studies, and you will have 28,200 results. And this was just 1 year after the pandemic results from 2020. And I remember when I first designed this search string, with the help of a medical librarian. And I would call for your attention here now for how many synonyms of COVID-19 that we have and we should use. So it would be COVID-19 with dash and without, and also we should use the name of the virus, which will be translated in the disease. So this is something very technical. But when we did this at the first time, it was in June 2020, there were already 85,000 papers being retrieved. And I just tried yesterday, and if you use this search in PubMed, which is the same database when this was designed, it will be 387,000. So it is a lot of information if we want to have a quick look or to find a study in PubMed. So we have to have our PICO well defined. Just an example for us to think about, a very broad and not sensitive and specific question could be the general population, and the interventions can be non-pharmaceutical interventions, but which non-pharmaceutical interventions? All? That won't be feasible. So we have to include all the non-pharmaceutical interventions that we want to look at in our search and into the PICO. The comparator can be no comparator, as the entire population was exposed to the interventions that were mandatory within our countries, and the outcome can be the decrease of the numbers of the COVID-19 infections daily, imagine in 2 weeks after the initial or the decrease of the non-pharmaceutical intervention. To consider a scenario, our question can be something like, which NPIs were considered to have the most impacted the epidemiological curve of COVID-19 over the last 2 years? Which our approach would be to identify which NPIs were effective in the containment of the spread of COVID-19. The study periods is very important.
Tem 2 minutos.
Obrigada. The study importance will be very important in terms of when was the information collected, so you can categorize in which curve of the pandemic or in which months that specific NPI was targeted and what was the effect. And then the PICO would be an example, would be among the population, which population, what is the effect of school closure in the spread of SARS-CoV-2, for example. Here, I will just give you an example of something that will be, for example, these systematic reviews and meta-analysis that was published by colleagues last year. And in their conclusion, they say that SARS-CoV-2 were markedly lower in school compared with household settings, suggesting that household transmission is more important than school transmission in this pandemic. So I think that how do we look here is, what is the population? So it would be children. So what is the setting? Would be schools. Is the school closure an NPI that we want to look at? Yes or no? What is the comparator? Would be school setting with household setting? Yes or no? And what would be the outcome? Would be that the transmission of the pandemic. So this is how we think when we will look for the inclusion or exclusion of this specific paper. This is here just another example. That would be, for example, the overview of technologies that were implemented during the first wave of COVID. This is a very interesting study, but is this an NPI that we want to include? What is the population? And for example, if it's just for healthcare workers, does it fill our criteria, and does it measure the impact and the effectiveness of a specific NPI? This is kind of questions that we have in mind when we see a paper like this. This is my references, and thank you very much.
Thank you. That was very interesting. So we're moving now to the last talk of this table that will be done by Mariana Peiroteo about information collection in literature reviews, tools, challenges, and their limitations. Mariana is a PhD student at the same university as Marilia, the Nova University of Lisbon, and she has a master's in public health and development. Her work focuses on digital health and health information systems. with the goal of defining the value of information on digital primary healthcare. And she will tell us about her experience in literature reviews within the PHIRI context. So go ahead, Mariana. I will let you know 4 minutes before finish so that we can still have 2 minutes for the discussion.
Okay. Let me just see what you're seeing. So thank you for the presentation and for introducing me. And in this presentation, I will just talk a little bit about the last step of doing the literature review and export all the articles and doing the search. So as my colleagues already presented, throughout this workshop, you have already understood the importance of defining the topic and the research question of a literature review. Then the importance of PICO, PIECO, or PIECOST, all the syllables, criteria, and also the inclusion and exclusion criteria, and also the relevance of the search strategy and the defining of keywords and strings, as Marilia said previously. And now I will tell you a little bit about the last step, which is the research and the extraction of the articles. And in this step, it's very important because it is where you define the databases that will be used, considering their relevance for the research and the extraction, and in this case, the import to the Rayyan tool. So, as you know, there are thousands of databases as such, and as such, repositories were created to group them together to be easier to search. The most four common in healthcare are Web of Science Core Collection, Elsevier, Google Scholar, and also the National Library of Medicine. And each differs either by the topic they are covered or by the way they are organized. For example, Elsevier is differentiated into Scopus, Embase, and Science Direct. And then we have, for example, the National Library of Medicine that differentiates, for example, in gene reviews, in PubMed, and in, for example, the MedTerms catalog. So what is the big differences between all these databases? For example, where in Elsevier we can choose, for example, to search based on the availability of the full article at the time of the search. And if we want like just Elsevier published articles or other publishers, for example, in the National Library of Medicine, it focused by the area of interest. In this means, for example, we have a database only for genetics and genomics. We have a database for life science and biomedicine, and we have, for example, just a database of catalogs of MedTerms. And in public health and population health research, the most common databases, as already some colleagues mentioned, are Web of Science, Scopus, Google Scholar, and PubMed. So let's see among the four common what we can identify the two major differences. It's the topic of the focus and the characteristics of the articles that we can collect. Either, for example, we want a more broad and generalized research or a more specific research, for example, with articles published in scientific journals or that have already undergone a peer review process. So, for example, if we want a search that is as general as possible, we have, for example, Google Scholar, which is where we can find everything. However, if we want a research about different areas but with the published scientific articles, we have Web of Science. If we want something more related to the human sciences, for example, and biomedical science and medical science, we have Scopus. And for example, if you want more specific articles about medical science, we have PubMed. So let's try to see why it's important we have to focus our research regarding each database. Let's do a little exercise. We have, let's imagine we want to do a literature review on assessing the impact of COVID-19 on children's mental health. In this case, we want a specific scientific articles because we want just to see what has been published with a peer review process already. And in this case, we have three areas of interest. As such, so PubMed will be the first database to define because it's the most specific in the topic that we want to study. And then between, for example, Web of Science and Scopus, we could choose Scopus, which allows us a greater relation with other areas that may influence the specific area that we want to search. It's important to notice that we can choose as many databases as you want, but for example, in this case, we will choose only 2, and in this little exercise. On the other hand, let's try, and we want to make a map of everything that exists on methodologies for evaluating and assessing health measures and policies. In this case, we want to find everything that has been described and published, including grades literature, and the best database is Google Scholar. And then we can choose, for example, Scopus, which allows us to focus more on the research of human and population sciences and have a greater relation between all the databases. For the last example, let's imagine we want to do an analysis of the effect of digital tools on patient follow-up during pandemic of COVID-19. And in this case, we want something specific, but we want to integrate 3 different areas, that is technology, life, and health science. So in this way, we can choose, for example, Scopus, who has the great differences of, diversity of topics, and Web of Science that will allow us to integrate the area of the technology. So by these 3 different examples, we could understood that we have a lot of databases, but the choose and the step to choose the database, it's really important for the results that we want to have and the kind of articles. In this way, we could narrow the research and narrow the articles that were going to appear, and to be at least a little bit easier to have like the criteria search and definition of articles to include and exclude. And now, during this workshop and during, for example, Mariel's presentation, it was possible to give us an example of a systematic literature review. And for this one, the topic and the research question was already taught. And we have, for example, the PICO criteria. And we have also defined the research criteria and some criteria to include and exclude. And so regarding, for example, this systematic review, in this case, let's just choose one database that could be, for example, PubMed, that it's the best option in this case. And then we will have to import the results into Rayyan. So I will just show you something that I think you would really like to see. It's, let's just put in here. Okay, now you're seeing my PubMed page, right?
Yes.
Okay. So I have already this search saved. And for example, in here, I have 82 results. This is just the search string is just a general search string. So I don't want you to focus like the terms that we are searching, just the process. So I have 82 results. In this case, we're searching on PubMed, and it's really easy, for example, to export the data and then to import into Rayyan tool. So we're going here on save, and we want to select all the results that were found, not only the results on this page, because in this case we only have 9, we want all the results, and you want to save in a correct format. In this case, let's try the CSV. And we want to create a file, and it's going to here.
Mariana, tens 2 minutos.
Okay, thank you.
Obrigada.
And in here we have the file. So we're going to Rayyan, and let's put a new review. So I'll put like how to import articles. Let's put like this. We want, in this way, you're learning already how to create a new review in Rayyan. In this case, we'll put like this research field as medicine and human health. The review type, in this case, is a systematic review. But as you can see, we have a lot of different types of reviews, and we can choose already in this case. And the review domain will be, for example, biomedical. And in this case, you could put the description. The description is just for you and for your collaborators and reviewers know a little about the scope. Let's just put like this. And then we will create. And now we will just put, sorry. And okay, I'll just put like this because this was just, okay, let's create. Now it's the important part where we can upload all the the references. As you can see, we have a lot of possible formats, but in this case, we've already defined it that we're going to use the CSV. So we're going to the downloads, and we have already here the CSV file that we have downloaded. So it's going to upload, and then we can continue. And ta-da. We already have all the articles, and it's important to see that all the articles were already uploaded, and then we can continue only into Rayyan. So all our articles were already on the Rayyan tool. So let's get back to my presentation. And I want to conclude to say that now it's your turn. So we're going to have like in the workshop aim, we're going to have like a practical tool, and we want to be able for you to do everything on your own. Thank you.
Great. Thank you very much. Well, before moving forward to the practical exercise, we have about 2 minutes for some questions to any of these presenters, to Cesar or Tatiana, Marilia or Mariana. So if there's any comments or questions, please go ahead. Just turn on your mics or yes, go ahead.
I have a question for Mariana, and it is how did you choose the articles and select them into these NPI? Also, how do you first had more articles and then you had to select the ones that interest you? How did you get them all together in PubMed?
Okay, so first of all, as like we have already said in this case, we have to define everything in the first hand. We have to define the criteria inclusion, the exclusion criteria, and
yes. But sorry to interrupt you. I mean, just just a process. How did you mark them? I mean, I have 200. I mark 10 because they are the selected ones.
Okay.
And how did you then get another list with just the 10 to import or to export? Sorry.
Okay, so when you select one article, it should be appearing like a button to say you only want to export the selected articles.
Okay. Then I must do it all at once, and I cannot have a list with 10 like you have.
Exactly. For example,
Okay.
and in this case, it's why the criteria and the criteria and exclusion criteria. Sorry, the inclusion and exclusion criteria. It's really important because in this way, when you're going to do the search, you have already excluded a lot of them. For example, if you want to do a search only on, for example, non-pharmaceutical interventions, we don't want all the clinical articles. So in this case, we could, in the PubMed, when you're doing the search, we can exclude all the clinical area related articles. So this is why before doing the research on PubMed, we can select everything and narrow the number of articles that are going to appear to us, because the less articles that's going to appear on our search, the easier is then to select the inclusion and the included and excluded articles. And to avoid like this, for example, you only want 5 articles or 10 articles, but it appears like 100. So the best process of defining everything, the better results we're going to have.
Okay, thanks, Mariana.
Yes, but we will see more of that now on the exercise. I just wanted to read one of the comments on the chat. That's by Jesus Leon Hernandez, who tell us, to me, the way to manage the articles is almost magical. It makes things easier. Thank you very much for showing the tool. So that's what we're going to do now. We're going to move to a practical exercise on Rayyan, on this software, and it will be performed by Cesar. Tatiana and Mariana will help us to move forward on this. So go ahead. I will give the floor to you, Cesar, Mariana, and Tatiana. Thank you very much. And we'll be back in half an hour just to conclude the session. So we start the exercise now.
Okay, so what's going to happen now is that I don't know if everybody read the document that we've sent. So for this workshop run smoothly, you should be already registered into Rayyan tool. So in this case, what's going to happen is that we're going to divide you in three different breakout sessions, two breakout sessions, sorry, and everyone should be appearing on the right side of the screen if you want to join or not. Only the persons which have already registered in Rayyan can go to the breakout session. If you're not registered in Rayyan, stay here with me that we can start the process in a little bit earlier stages. And then we get back all together just to discuss and to close the workshop.
If there are no questions on this part, I will start a breakout session. And every time that something is not working, just go back to the main session and send a message in the chat, and I will try to put you in the right place.
Okay, now you're seeing my screen, right? From Rayyan?
Yes, we can.
Okay, then I will get back just for Rayyan. If you want to do it, you can do it with me. And what we want to do is to, you can sign in if you have already an account, or you can get started and register. It's important to say that this is a tool, free tool, sorry. But you can, for example, have more features if you want to pay. In this case, we're just going to learn to show you the free tool features, because it's not necessary most of the times to pay for all the features that we want to show you. And it's the most common features that we use in a literature review process. So you put get started, and in this case, you can put our email, you can put the passwords, we confirm, we put the first name, last name, for example, the title, the organization, and we can do all these data, and then we put sign in this case. The part of the name, the last name, and everything, it's important because when you're going to be in a review with other collaborators or other researchers, you can see your name and who is doing what. This is really interesting for what I'm going to show you afterwards. So I will just slowly continue because this is what's going to appear afterwards. In this case, you will have no reviews in here. This is a review that I've already had. But in this, for example, in this desktop page, we could have an overview of all the reviewers that we are doing, like active reviews. We have like the tab of the collaboration reviews, because you can be either an owner of a reviewer, or also you can have a collaboration review. And in this case, you could see all the reviews that you're collaborating with. This is if you are a translator. In this case, if you have to translate some articles for your native language, and other reviews. Other reviews is just a tab for all the public reviews that already open in Rayyan tool, so you can help and define anything. And you can choose, for example, if you want just to spare time and review anything. So if you, I don't know if in the chat anyone said something, because in this case, we can, if you wanted to do it by yourself in an live environment, we could add you I could invite you for this this review. And for example, we can do it all by all in the same time, and to see the results of our classification. It would be really interesting. I don't know if you want to share your email or something, so I can add you to the Rayyan tool. Okay, Alicia, thank you so much. I will put in here, so you will have like an overview how to invite collaborators or other reviewers. We could add a collaborator, and in this case, the collaborator will only be able to classify and add labels and include or exclude articles, but they can't put like the blind on and blind off mode, and they can have like administrative possibilities to this review. But let's put like you're also a reviewer, because as our colleagues already mentioned, it's important to have more than one review, and then we have like the third or the fourth reviewer. Let's put, for example, and in this case, it's important, it's easier to send to invite a lot of people, because we just put like with commas and to separate with dots and a comma. And
there is another person that would like to join, and there is an email in the chat.
Yeah, Carlos, I'm already putting the chat in my other screen so I can see everyone if wants to join. And you can invite people in any time of the review. So it's not a mandatory field to be right on the beginning. So we're going to put everything as long as people wanted to join. And so we could put a reason or a message. Let's just put help me with this review. And what's going to happen is that you're going to receive an email to Ryan to be joined in this review. So let's invite Alicia and Carlos. Oh, sorry. Okay, invitation sent successfully, and we will wait. So we will see something interesting. So in this case, we have the blind on mode. And we've already see that we have Carlos and Alicia in these reviews. And it's in this case, we can see how many, as Cesar already mentioned, we can see if I would like to join. Okay, of course, just send me your email, please, and I will join you, because in any time we can invite people over. In this case, let's put the blind on mode, because we can see the reviews, the articles, sorry, and we can include or exclude. Okay, it's important. Invite. So let's try to see what's going to happen. For example, I've already know that I've logged in this review one time, and I have been in here 6 minutes. So let's try, for example, to show what's going to happen when we show. We have already 5 articles about the NPI's review, and what we want to do is to read only the title and the abstract, and to see, in your opinion, if you could include it, if you would include, to exclude, or maybe, always regarding the PICO criteria that were mentioned. If you want, I could put the PICO criteria on the chat if you want to see it again, and then you can analyze, and we will give you like 10 minutes if you can, if you wanted to read only on your computer the ones that are in here, and want to put just include, exclude, or maybe. And in the end, what we're going to do is to put the blind off feature, and we can see what each reviewer classified, and we can see if you have like an agreement or a disagreement, and to ask of each reviewer what is their opinion on each article. Just to inform you that it's important to say that in here, there are articles we want to include and there's articles we want to exclude. So do it as your wish. I will put just the PICO criteria on the chat because I think it's easier for you. So in the chat, we have already the theme, the research question, and the PICO criteria. Oh, I think yeah, it's missing the outcome. Sorry. Okay, here we have. So the idea is just to classify the articles regarding if you would include, exclude, or put on maybe, because you don't have any, if you have any doubts or any questions. You're free to turn your microphones on if you want, just to be, if you want any doubts, if you have any questions or anything. And whenever you're ready, we can, you just say, okay, I've already finished all the 5 reviews of the 5 articles, and I've already decided if I wanted to them to be included or excluded. And in the meantime, we can, for example, put the blind off mode and trying to see what you decided. I will just, I stopped my share my screen because I'm already also putting if I wanted the articles to be included or excluded. In the meantime, if anyone has any doubts or any questions, you can always join in and ask, even if it's not of this part of the workshop. And if you want to discuss something, it's interesting to do it right now. Is there anyone finished yet, or?
Hello, Mariana. How is it going here?
I'm giving them time just to read the articles and trying to select and to see if they wanted to include them or exclude.
Okay, perfect.
I will give you just like how much time do you have, Miriam? Sorry.
Now it's 12:20, so we have started the breakout session 15 minutes ago. So in theory, 5 more minutes.
Okay, so sorry, I can't get into the shared document. Oh, sorry. I've put Carlos. Sorry, I've put the criteria in the chat if you wanted, just for you to be able to select. In the meantime, it's important to say that this review can be open, for example, for 3-4 days. And if you want, you can do it later. You don't need it to do it right now. So if you don't have access to the shared document, we can just give you time, and afterwards you can decide if you want or not. But I think in the meantime, I will just show you the results, for example, and some features that you are able also to use in Rayyan. So you're seeing right now my screen, right? The Rayyan into the Rayyan.
Yes, we can see there are some pie charts.
Okay. So in this case, for example, when we were open our review, it is blind on feature on, right? And then we can see already, for example, okay, I've seen that Paula already put one include, one exclude, but we don't know which articles are. We just see the number of articles that people are already filling in. And then we can see like an overview of the included and excluded articles. So let's try to see what's happening. In the meantime, there is a blind mode on, and let's see what I can see. It's my only my criteria, only my results and my opinion. So when I'm going in here, and it's important to say that we can, for example, see the auto deduplicates. So if when you import articles, they might be like duplicates, and the Rayyan tool already only presents you the not duplicates. So if you want to see, for example, we have two exact matches of a new approach to identify a pathogens article, for example. So this is automatically done. But you can also, for example, do again to detect duplicates, and we will be able to see if there's even in the meantime duplicate or not. We have the inclusion decisions. We can see how many articles I've already, for example, put in include or exclude, or I've put maybe, or the ones that I'm missing to include. And we can also put, for example, in this case, the keywords. In this search, I just tried to use, for example, we've put, we have the standards that are already automatically be uploaded in Rayyan. However, we can add ours, our own keywords, and keywords to include and exclude. And this is important because then we will, for example, when we're going to read an abstract, we can see like the highlighted words that are the keywords that we want in red are the exclude, and to include in green. So we can see in an overall, if you want like to put in or out. This is really interesting and it's easier. For example, for 5 articles, it's not that much, but when we have like 2,000 articles, it's a lot. So it's just a way to get the process easier and quicker. And for example, we have the exclusion reasons, and in this case I put, for example, you can add a reason to exclude the article, and you can put a label. It's important to see that, for example, to add, if you want to exclude and to put a reason, usually this is only mandatory after the full text screening. You don't need to put every reasons when you're doing the title and abstract. We're just going to use it because, for example, it's interesting for you to know that we can have the major overview of all the reasons that we want to exclude. For example, if we have a lot of reasons that are the most reason is, for example, wrong population, we can understand, for example, in our search, we didn't define very well the keywords or the search string, and we didn't narrow the population down as much as we wanted. And the same for example, intervention, or the same for outcome. This is interesting just to see and to learn for other reviewers that we want to do. And also we can have a label. Labels can be used for anything that you want. In this case, for example, we usually put the outcomes that it would be easier for us to analyze afterwards. We can put, for example, in this case, contact tracing apps for the COVID-19 pandemic. The non-policy measure that we want to address in here could be, for example, contact tracing. And in this case, we add contact tracing, and we can see how many articles have already been done on the contact tracing mode. And for example, in this case, would be a rapid review of the use of face mask in preventing spread. So this article I put in include, and I will put the label. It's not contact tracing, but it's, for example, face masks. And I will add it. And in the end, we can see, for example, in the tables, we have one article of contact tracing, we have one article of face masks, but we can have, for example, if there were like the 82 results that I've retrieved in my session and in my presentation, we could see, for example, 10 of contact tracing and, for example, 20 of face masks. So we know that the most common study non-pharmaceutical intervention is face masks, and this we can do it for every article. So let's try to get back and to put the blind off mode to see what. I just give some time to everyone be able just to do the articles, and let's put blind off. Okay, so it's in here. I will put blind off, and then I will show. So as you can see in here, we could see which reviewers put include, which reviewers put exclude. And this is why the agreements and disagreements in the Rayyan tool, it's easier to at least to discuss with the reviewers. So if you don't mind, I would ask, for example, Paula or Alessia, if you want to just to share or to comment, why did you put, for example, in this case, the article of COVID-19 professional practice in closed institutional settings, why you wanted to include them, and why, for example, I put exclude. In my opinion, for example, we decided that the population is all population, all general population. And this article mentions only a review of institutional settings. So in this case, the population wouldn't be all population, will be a specific setting. So in this case, it wouldn't be, for me, it would conflict with the population, for example, criteria and on PICO's settings. So in this way, for example, I could put, this is a conflict, right? And in this case, we could put, we can see how many conflicts we have. So in this case, we have this one because two reviewers put include and I put exclude. And now what we can do is, for example, in my opinion, it's an excludes, it should be excluded. But for example, imagine if I'm wrong and this could be included. So what I'm going to do is to change my opinion. We can do it in all types. So I put include. So in this case, I will take back the reason why I excluded, and it's automatically being uploaded to the included articles, for example. And this is why it's really important to have, like, for example, a lot of more than one reviewer, and the feature of include maybe in exclude, and to put a reason feature is really important and it helps us. And the label is just afterwards when we want to analyze and to see how many articles and how many outcomes, for example, were already appearing on our search. This helps, for example, for the discussion part, or if we're writing an article on this systematic review. And I don't know if you have any question in this case. Yes, Miriam.
Just a very small note on the time. I will be closing the breakout session in a little bit more than a minute, just for letting you know.
Okay. I understand now the exclusion reason that you have explained. I agree with you. Okay. So in this case, for example, if you wanted Paula, okay. Thank you, Carlos. I hope you liked our workshop and you learned. If you have any question, you just say it. And for example, Paula, yeah, you could, for example, now I will put exclude because it's exclude right? It would be an article to exclude of our research. But for example, you could change. And in this case, we could see that Paula already, for example, changed to exclude the article. So I think we could put iLots on and iLots off. This is another feature that it's really interesting because, for example, of the keywords that I've said that we can include or exclude, we could see them in this case, and we can not see them if we didn't want it. And also, there's another thing. In this case, I can't show you because there are there aren't that many articles to be able to Rayyan to do this, but we have the compute ratings tool. And in this case, what's going to happen is in here, in the rating column, it will appear like 5 stars. And we could see if the article, for example, had only 2 stars, it probably would be excluded. And if it had like 4 stars, it will be included. So I will stop sharing my screen because we're getting back. And I hope you have learned everything, at least for the ones who are in my session. I don't know if you have anything.
We got some problems in our room. Sorry, we got some problems in our room to conduct the exercise. It couldn't be possible. Then I explained to the participants what to do the things.
Okay. it was interesting. For example, I think it would be interesting to share just what happened in each breakout session. For example, so I know that in Caesar just you weren't able to do the exercise. For example, in our case, we've been with Alessia and Paula and Carlos that already left, but they were able to join into signing into Rayyan tool, and they were able to select and exclude or include the articles. And it was really interesting because we were able at least to see what happens if we have a a conflict. We could see the duplicates, and we used also the blind on and blind off tool. And we also, for example, discussed why we have a conflict in one of the articles. So it was, at least I think we have a discussion of the articles.
Yes, I think in my group it went very well. Maybe I should ask the participants to comment rather, but we tried to see how we can use the tool. It was not so much time to actually read the abstracts and properly evaluate them, but I think it was more for the technical point of view to see how the Rayyan works and how we can see that we disagree and how we disagree and how we resolve that, and to count in Rayyan and so on. But maybe if participants would like to share.
Diana, can I? We talked about the EndNote, and that's how you did it previously. But was it possible for two reviewers to rate it, or how did you see then conflicts with another review in EndNote?
Then I didn't. Then we had to count it actually manually. So that's why Rayyan is very good, because it counts for you, counts automatically, and that really saves time.
Right. And there's another question. And now you don't use, you don't duplicate, you don't import into EndNote, you just don't use EndNote anymore.
I use EndNote a lot. I use EndNote. I use EndNote to deduplicate, even though I think some colleagues use the Rayyan to deduplicate. I had in the previous experience, I was more like confident in EndNote, confident in me with EndNote, how to deduplicate there. So I used it EndNote. And then Rayyan for the title abstract screening, and then again EndNote to read, because I was just more, I got used to it more to EndNote. So I think you can use both tools, but Rayyan was definitely very useful for title abstract screening. Yeah.
Okay, thanks.
I have a question about the full text review, which comes after the title abstract. Did you try this in Rayyan?
Mariana,
okay. Can you upload the PDFs like in a bulk mode? You know what I mean? Not one by one.
Yeah. So, for example, if you have, when you're doing the import phase to the Rayyan tool, for example, from PubMed, all the available articles at full text, it's already automatically uploaded. So you don't need to upload one by one. But for example, if you don't have one, when you're doing the full text search, you have to do it. That's why, for example, when we're importing, it's interesting to see also not only the topics for the database, but also the availability of the articles. If you search on database, for example, that only have articles at a full text availability only by Elsevier, so a lot of other publishers don't have it. So we need to make it one by one. But that's one of the interesting parts of also choosing the database. But you can do it in Rayyan. So if it's available when you're doing the search on the database and you upload it, it will be automatically uploaded.
Okay, because for example, I don't know, do you have any experience with COVID-19?
Yes.
Oh, also. Great. And because there is an option there that you can upload the whole folder, right, with the PDFs, yeah. And it links one by one automatically.
Yeah, that's true.
Okay, and this is not in Rayyan, right?
No. In this case, it's one of the limitations on Rayyan. It's this one.
Okay. The last question, I'm so sorry, but is there any other advantage in COVID-19?
I think. Sorry.
No, versus Rayyan. Yes.
Regarding, do you want more vantage story on Rayyan or on incovidence? I didn't understand.
Incovidence, both.
So in my experience, Rayyan, at least Covidence, it's more intuitive. So if you're not like super comfortable doing a systematic review, and the process of doing a systematic review, Covidence is more intuitive and it's easier to use. On the other hand, Rayyan, it's more easier if you are a multidisciplinary team, and if you want like to have a lot of articles and to discuss about the resources and the conflicts, and you have less time to do it. For example, in the case that Cesar explained, the best option of platform to doing this systematic review, for example, is the Rayyan tool. However, for example, regarding the example, the NPIs and the effectiveness, we could use Covidence. So I think it's one is more intuitive and easier to use, and the other one, it's easier for multidisciplinary teams and when we want to have a lot of different roles in reviews. Okay. So we want a translator, we want a collaborator, we want a reviewer, we want a third reviewer, we just want a viewer. So in this case, you could separate the roles for the research.
Okay, so thank you very much to everybody, also for the very nice comments on the chat. I'd like to thank especially Cesar, Mariana, and Tatiana who ran the exercises. We're sorry, I mean, it's really hard they worked very hard, I can't tell you, for this exercise. We're sorry about technical difficulties. It's not the same to do it online as it is to do it in presence. So hopefully one time we will be able to do a presence workshop and teach you much more about Rayyan. We hope that our experience was fruitful to you. We also thank Danielle and Marilia who have explained their experiences. And here our goal was to focus more on the process and on practical abilities than what you can find on papers about literature review, but of course we had to combine both of them. So I invite you to come back to us if you need any specific comments or questions. We are available to answer you. Well, not me, but the experts here we are available to answer. And we'd like to, so we're closing this session. Thank you very much to everybody.
Thank you, João, for organizing this and everyone.
Bye-bye.
Thank you so much to all presenters. Bye.
Thank
Thank
you.
you.
Bye.
Everyone. Bye bye.